Hi there. This video is to show how our systems can be used to record all the bloods that are taken, and then the pathology part of our system can use that to reconcile the bloods and work out when they're all back. In theory, all practices are supposed to do that. If you take bloods, you're supposed to make sure you get the results. In reality, I don't think many do it because there's a huge amount of work involved. As much as possible, this system automates it. So if you're using our systems properly, this is the list of bloods that this patient needs. I'll be looking at ad hoc requests, medications, all those sorts of things. And so we can click on this button here, blood sample taken, and it's asking me which ones I've taken. Most of the time, hopefully, the answer should just be display bloods only. There are other options here, like if the bloods aren't for practice, and so we're not needing to reconcile them, if they're for the NHS health check. Perhaps occasionally it might be a mix of others and displayed. And so I'm just going to show you how that works for argument's sake. So in the background, the system's kind of seeing what's already in there. It's going to add various codes for me. So it's going to code that I've taken a blood sample, that there's consent, aseptic technique, things like that. So here we can see the list of bloods that the system's already recording. There's no need to add those in. There's also no need to add in things like EGFR or T4 or things that would just be part of that blood test. But say, for example, I don't know, CA125 is being done as well. If I OK that, I can also free text in there ones that aren't in that list. Although if you're going to be reconciling the bloods, you want to do that only when you really need to, because that means then we've got to do a manual check. What the system can do is it can look at the codes that are added, look at the results and work out, are they all back? If you free text it, someone's going to have to go in and check that if you want to reconcile them. If I come to the tab journal here, you can see then that random sample, aseptic technique, informed consent, blood sample taken. There are quite a few codes, partly because the system needs them to know exactly what's being done and how and so on. But there are codes here that hopefully make enough sense to know what bloods we're talking about. So full blood count, HbA1c, CRP, ESR, LFTs, UNEs, and down here we've got the CA125. So initially that can just be useful to be able to look back and know what's recorded. I know some practices will manually type in what bloods are being taken. Effectively, this is doing that for you. The really powerful tool is we can then reconcile the results. And because we've reconciled the results, we can then do things like bulk text patients to say, all your results are back. They're all satisfactory. No more action is needed. We'll look at that stuff in other videos, but that's all for now. Thanks.